My name is Matt Yin. In this short video, I am going to be talking about pressure ulcers and how you can prevent them in loved ones. First of all, what is a pressure ulcer? You may have heard the term before and been confused as to its meaning. Pressure ulcer is just a medical term for bed sores. They generally happen to people who spend long periods of time in bed, such as those in a hospital or even a nursing home. Bed sores are very common and can occur in up to 25% of patients when they stay in a hospital. In most cases, they occur on what's called bony prominences. These are places where there's only a thin layer of skin above the bone, providing little padding. Places such as your heels, your tailbone, and your hips. Over the last year, it is estimated that 2.5 million cases of bed sores were treated in the USA. This costs over $11 billion. So, what causes bed sores? The main cause is a lack of blood flow. Your blood vessels carry blood to your skin. However, if there is enough pressure, these blood vessels will close. Once closed, the blood does not flow to your skin, and your skin begins to lack oxygen and other nutrients. Without these nutrients, your skin will eventually die, and that's the beginning of a pressure ulcer. Scientists have found that blood vessels are held open with a force of 32 millimeters of mercury. So, if you're pressing harder than that 32, you can be stopping blood flow to the skin. To give you a little idea of how small of a pressure it takes to cut off blood flow, when you sit down, there's about 300 millimeters of mercury of pressure on your bottom. So, putting over 32 millimeters of mercury of pressure is fairly easy. If blood flow is cut off for more than a few hours, then there's a risk of developing a bed sore. You may be wondering, if sitting causes 300 millimeters of pressure, how come you don't get bed sores from simply watching a long movie? Well, the reason is that when you're sitting, you're also changing your position a little bit. You will learn why changing positions prevents bed sores in just a few moments. Now that we know why bed sores happen, I am going to give you 3 key ways to help prevent them. The overall picture is that the key to preventing bed sores is lowering the pressure and restoring the blood flow. One of the best ways to prevent pressure ulcers is to change positions every 2 hours minimum. By changing positions, you allow those areas that were under high pressure to get blood flow again and prevent a bed sore. For instance, if you notice a loved one has been lying on their back for over 2 hours without shifting positions, you can turn them on their side or have them sit up for a while. This will take the pressure off of their tailbone and shift it to other areas. By constantly shifting positions, no area is cut off from blood for long periods of time, and bed sores are unlikely to develop. So, when you're sitting and watching that long movie, your shifts in position not only help get you more comfortable, but are also preventing bed sores. If you sat absolutely still for that whole movie, then there's a chance that you would get a bed sore on your bottom. Another way to prevent bed sores is using a special bed. These beds are designed to spread out the pressure more evenly than a regular bed. There are a few different types of these special beds, such as air and foam mattresses. Research does not clearly say one type is better than another, so there are different options to choose from. One study showed that using a special foam mattress and changing positions lowered the rate of bed sores from 20 to 3. The last method I want to mention is using protective pads to prevent bed sores. These pads are usually made from foam and purposefully designed to protect skin. They're like Band-Aids in that they have a soft spot in the middle and tape around it. You place the pad over the area of the skin that you want to protect, and the tape keeps it in place. Some are made for your heels, and some are made for your tailbone, as shown in this picture. A study in Italy found that using heel pads lowered the rate of heel sores from 43% to 4% in high-risk patients. Similarly, a study in Sweden showed that tailbone pads reduce the risk of bed sores from 12% to just 2%. In summary, bed sores or pressure ulcers are a common medical problem in the hospital and in nursing homes. They commonly occur on the heels and tailbone. 3 key ways to prevent bed sores are repositioning every 2 hours, using a specially designed bed, and using protective pads. Thank you for watching this video. I hope you take your newfound skills and use them to prevent bed sores in your loved ones.